Original Medicare versus Medicare Advantage. What are the pros and cons of both? That's what we're going to talk about in today's video, so please stay tuned. My name is Jamie from meetjamie.com. I'm a licensed insurance agent. I help people understand how the Medicare program works, as well as connect them with the coverage that fits their needs. If you have questions or you're learning about Medicare, feel free to leave a comment below, or you can also reach out to me through my website or through my toll-free number, which I'll leave both in the description of this video. So if you're new to Medicare or about to be new to Medicare, maybe you're getting ready to turn 65 and you're just learning about Medicare. By the way, if you are, make sure you subscribe to my channel and click the bell notification so you're notified when I upload. You have two paths in which to receive your Medicare benefits, and the choice is yours. Either you choose Original Medicare, that's your little red, white, and blue card that you'll get in the mail, or Medicare Advantage. You have to choose one or the other, and you're here today to watch this video to find out the pros and cons of both. So without further ado, let's jump in and talk about the pros and cons of Original Medicare. So first, the pros of Original Medicare. With Original Medicare, you have nationwide coverage. So Original Medicare is widely accepted by healthcare providers across the country, providing flexibility for beneficiaries who travel frequently or reside in multiple states. So in the process of deciding whether you should use Original Medicare or Medicare Advantage, think about how often you travel. Or do you have two homes, maybe one up north and one down south for the winter? That's a consideration that you want to make. Next, you have relatively predictable costs. Now, there are deductibles and coinsurance and costs outside of Original Medicare. That's why a lot of people choose a Medicare supplement plan or a Medigap plan. But if you're relatively healthy, then you're probably going to mostly be paying for your Part B, which this year is $174.70 a month. I talk to a lot of people and they don't go to the doctor much. They're healthy, which is great. But again, if you were to start using Medicare, Medicare is going to cover roughly 80% of your expenses and you're responsible for the 20. So that's why people do a Medigap policy, which we'll talk about again here in a second. The other nice thing about Original Medicare is you have access to specialists. So with Original Medicare, beneficiaries can directly visit specialists without needing referrals from primary care physicians. That's one of the big differences between Original Medicare and Medicare Advantage. Next, let's talk about the cons of Original Medicare. So there are coverage gaps. Again, roughly 80% is covered by Original Medicare. You're responsible for the 20%, which again, you can get a supplement for. Also, it doesn't include prescription drug coverage or routine dental, vision, and hearing. Now, there are policies you can get to cover that. We're not going to cover that in this video, but there are policies you can get to supplement that coverage. Next is the out-of-pocket costs. So there are, again, deductibles, coinsurance, co-payments, and if you do have chronic health conditions, this is something you want to be aware of. And then finally, if you do decide to use Original Medicare and you purchase a supplement policy, you will have to purchase that through a private health insurance company. Many people choose a supplement insurance plan, also known as Medigap, to help cover the gaps in Original Medicare, which then will add to your overall costs. So you'll have the $174.70 a month for Part B for most people, and then a supplement. All right, let's get into the pros and cons of Medicare Advantage. So the pros of Medicare Advantage is you have all-in-one coverage. So some people like the bundled aspect of Medicare Advantage because they often include prescription drug coverage, additional benefits like dental, vision, and hearing. It's a simplified healthcare management for many beneficiaries, which they really enjoy. They do have out-of-pocket maximums to cap your costs. So the plans typically have what's called an annual out-of-pocket maximum, similar to a deductible, maximum deductible, providing financial protection for beneficiaries, unlike Medicare, which has no cap on out-of-pocket costs. Also, care coordination. Some Medicare Advantage plans offer care coordination services, which can be beneficial for individuals, again, with complex healthcare needs, helping them navigate the healthcare system more effectively. All right, so let's get into some of the cons of Medicare Advantage. So one of the big ones for a lot of people is the network restrictions. Medicare Advantage plans often have networks of doctors and hospitals, and beneficiaries may need to use providers within the plan's network to receive full coverage, limiting choice compared to original Medicare. Also, prior authorization. Some services may require prior authorization from the Medicare Advantage plan, which could lead to delays in receiving care. Geographical limitations. Coverage may be limited to a specific geographic area, which again can be problematic for beneficiaries who travel frequently or, as I mentioned earlier, have residence in different states. So there's a lot to weigh here when you're considering original Medicare versus Medicare Advantage. So ultimately, choosing between original Medicare and Medicare Advantage is a significant decision that depends on individual healthcare needs, preferences, and budgetary considerations. While original Medicare offers flexibility and nationwide coverage, Medicare Advantage provides comprehensive benefits and out-of-pocket cost protections. It's essential to carefully evaluate the pros and cons of each option before making a choice. Additionally, beneficiaries should review plan details annually during the Medicare open enrollment period to ensure their chosen coverage continues to meet their needs. By understanding the difference between these two options, beneficiaries can make informed decisions to secure the health care coverage that best suits their circumstances. So that's all I have today in this video, just giving you some pros and cons to consider as you consider Medicare and the options that are in front of you. Again, if you enjoy videos like this, make sure you subscribe to the channel, hit the like button, maybe pass it along to a friend who would find it beneficial as well. Thanks so much for watching, and we'll see you in the next one. Have a great day.